So in this video, we are going to discuss the maxillary sinus. It is located, as I told you, it was located in the body of the maxilla bone, and it is largest sinus. It is pyramidal in shape. Now, if this is our nose and this is the lateral wall of the nose, so maxillary sinus and its pyramidal shape is such oriented that base of the maxillary sinus is toward the lateral wall of the nose, and the apex is toward the maxillary bone, but the zygomatic process of maxillary bone. So again, on the lateral wall of the nose, there is base of the maxillary sinus, and on the zygomatic process of the maxillary bone, we have the apex of the maxillary sinus, and its lower part, its opening is located in the lower part of hiatus semilunaris. This is the middle meatus, and in the middle meatus, this is bulla ethmoidalis and its hiatus semilunaris, that is its door or opening. In the lower part of this hiatus semilunaris, we have the opening of maxillary air sinus in the middle meatus. Now, they are saying that when maxillary sinus is seen in an isolated skull, it is seen to be a bigger opening, whereas in an intact skull it is 3 to 4 millimeter in opening. Why is that so? Because in an intact skull it is covered by a lot of things, and I've made the things that are covering it. There are some things that are covering it superiorly, some inferiorly. So some things that are covering it superiorly, they are lacrimal bone, the descending part of the lacrimal bone, and the uncinate process of the ethmoidal bone. They are covering the maxillary sinus superiorly. And inferiorly, we have the inferior nasal concha, which are covering it. The anteriorly, we have the lacrimal process of the nasal concha that is covering it. And posteriorly, the part of the inferior nasal concha which is covering it is the ethmoidal process. So superiorly, it was covered by the lacrimal bone and the ethmoidal bone with its uncinate process. Inferiorly, it is covered by inferior nasal concha and their lacrimal and ethmoidal processes like that. Then it is covered posteriorly by this perpendicular plate of palatine bone, which is also pushing it to reduce its diameter to 3 to 4 millimeters only. Also, this purple thing, it is the mucositis line which is lining the maxillary sinus, and mucosa is also limiting its opening, which is very big in the isolated skull. But because of all of these opening, the inferior nasal concha, the uncinate process, lacrimal bone, perpendicular plate of palatine bone, all of these processes are causing the maxillary sinus size to shrink. Now, height of this sinus, it is this height is 3.5 centimeter. Its width like this is 2.5 centimeter, and its anterior-posterior depth like this is 3.5 again. So height and anterior-posterior is 3.5, whereas its width is 2.5 centimeters only. Now, one thing we need to know, that this maxillary sinus is located somewhere like this, that it is superiorly bounded by the undersurface of orbit. Inferiorly, it is bounded by the alveolar process of maxilla, and its floor is somewhat oriented, that it is 1 centimeter below the floor of the nose, or the floor of the maxillary sinus is forming the lower border of ala of the nose. If you have studied about the vomer of the nose, so vomer of the nose has this superior portion, and then this inferiorly divides into this portion which is known as the ala. So the ala of the nose, they are forming the lower part of the maxillary sinus. Now, superiorly, this maxillary sinus has also one thing which is going to innervate it, that is the infraorbital nerve. And also they are saying that inferiorly, the maxillary process or the alveolar process, it is grooved by a lot of things that are molar and premolar tooth. Also, in the anterior lateral side, for example, if we make our maxilla like this and maxillary sinus is somewhere like this, so anterolateral margin of the maxillary sinus, it is grooved by the canine tooth, because anteromedially we have the incisor tooth, but anterolaterally we have the canine tooth. Now we will go towards its arterial supply. Since the maxillary sinus is located in the face, so it is supplied by facial artery, then it is supplied by inferior orbital artery and greater palatine artery. Why it is supplied by inferior orbital? Because it is below the orbit. Why it is supplied by facial? Because it is in the face, and greater palatine because posteriorly we have the palatine process of the palatine bone. Now venous drainage, it is either into facial vein or either into the pterygoid venous plexus, because this whole location is actually in the pterygoid fossa, so that is why pterygoid venous plexus. And lymphatics, the lymphatics are going to be in the submandibular lymph nodes, and nerve supply is via two things. One is infraorbital nerve and one is the maxillary nerve. The infraorbital nerve has anterior and middle superior alveolar branches which are going to supply it, whereas the maxillary nerve has the posterior superior alveolar branch which is going to supply the maxillary sinus. So it was all related to the maxillary sinus. Now we will move towards its clinicals from BD Chaurasia. Now, the infection of a sinus is actually known as a sinusitis, and due to the sinusitis, what we will have headache, persistent cough, thick and purulent discharge from the nose, and diagnosis is assisted by transillumination, radiography, and a simple diagnosis is that you ask the patient to bend their head, and as a result of bending, if they have pain in their head or headache, that is because of the inflammation of sinuses or sinusitis. Since we studied the maxillary sinus right now, so we will discuss the maxillary sinus, which is the most commonly inflamed sinus, and due to its inflammation, what will happen? The pain will radiate to teeth because, you know, inferiorly the maxillary sinus is related to the alveolar process of maxilla, and also it will go to the infraorbital sinus because superiorly the sinus was related to the orbit. So this is how both the pain of the sinus is spreading to the teeth and to the infraorbital skin. Now drainage of the sinus is very difficult because its ostium or its opening lies at a higher level. You know, I told you that ostium is the opening of the sinus into the lateral wall of the nose. And when we talk about maxillary sinus, it is located somewhere here, but its opening is into the middle meatus. So you can see that its opening is very much above its floor. So the drainage requires some sort of surgical process, and we can make the drainage by a surgical intervention, and that surgical intervention are of two types. One is antrum puncture and other one is opening in the canine fossa. What is antrum puncture? In the lateral wall of the inferior meatus, we can puncture a hole and we can push the fluid from the maxillary sinus through that opening into a lateral orifice. For example, you know, this is our nose, and when we drew the turbinates and meat, this location that was just below the inferior concha, this was known as the inferior meatus. So if we drill a hole in the wall of the inferior meatus, we will have an antrum puncture to naturally allow, natural orifice is formed to allow the maxillary sinus fluid to go. And opening can be made in the canine fossa, as I told you that in the maxillary process, in the anterolateral wall of the maxillary sinus, there was this canine tooth and it has its own fossa. So we can make an opening in the canine fossa, but through the vestibule of the mouth. And from the vestibule of the mouth, we can drain all of the maxillary fluid from that opening through the vestibule of the mouth, and this is known as Caldwell-Luck operation. Now, carcinoma of the maxillary sinus. As I told you, what is a carcinoma? Carcinoma is a cancerous tumor and it can grow to any region. For example, first of all, if it goes to the roof, that is the orbit, what will happen? It will cause proptosis, diplopia. Diplopia is double vision. In the infra, and as I told you, this orbit region was also traversed by infraorbital nerve. If the infraorbital nerve is also involved, it will cause facial pain, it will cause anesthesia of the region of the maxilla that is supplied by the infraorbital nerve. So periodically it affects the infraorbital nerve and the orbit and causes proptosis and diplopia. Then floor. As I told you, the floor was formed by this alveolar process of maxilla. So if invasion is the floor is produced, it will cause bulging or ulceration of plate. We have palate which has hard and soft palate. So inferior process of the maxilla is also related to palate. So if the maxillary sinus carcinoma goes to inferior side, it will cause the palate outward bulging. Then forward growth obliterates the canine fossa. As I told you, the canine fossa was also related to it. So if the sinus carcinoma grows forward, it is going to involve the canine fossa and produce swelling of the face. And if it grows backwardly, it will damage the palatine nerves and severe pain in the upper teeth. So superiorly it affects orbit, diplopia, proptosis. Inferiorly, bulging of the palate. Anteriorly it will cause bulging or pain in the canine fossa. And backward growth will affect the palatine nerves and severe ruffled pain to upper teeth. And now growth in the lateral direction, for example, if this sinus grows into the cheeks, then it will cause a face swelling of the face and a palpable mass in the labiogingival groove. This labiogingival groove is the groove with the lips and the gums, that is labiogingiva. So in this labiogingival groove there will be a palpable mass that will be produced by the growth in lateral direction, the swelling of the face, and a tumor in the labiogingival groove. So with that, we are done with all the clinicals related to the maxillary air sinus and its anatomy. I hope you understood each and everything. In the next video, we will discuss the next sinus, which is our sphenoid sinus.